Our subject, who we'll call Paul, finishes his day of work where he was focused the whole time and he made a reasonable wage, where he applied his college education and understood his work and communicated well with others, and he gets in his car to drive home at the end of a long day. Paul schedules an appointment with a doctor in which he will be spoken to at a level that he understands completely and is able to follow the provided medical advice, as well as understanding the reasonings behind each treatment measure, each prescription, each reason that the doctor has to be speaking with him about his healthcare. For our other subject, John, this day is a lot different than Paul's. He never got the chance to go to college, and he works a minimum wage job where he struggles to move up, and he needs a ride home where an aide will help him to meet his daily needs: food, medication, social skills, etc. When John visits the doctor, he is accompanied by his aide, but he still struggles to understand the complexities of his doctor's recommendations. This only further builds on some of his poor health behaviors, such as an unhealthy diet, an unwillingness to work out, forgetting to take medications. One of the biggest differences between our characters, Paul and John, are that Paul does not have a learning disability, and John does. It is evident in their everyday lives, but especially in their health outcomes. John does not receive the same opportunities and specialized help that Paul does. A person with a learning disability is more prone to these negative health outcomes because their tendency towards disease, poverty, and the frequent dependency on an aide to manage their responsibilities tends to put them in situations in which they're not going to be able to have the same opportunities as someone without these things. A learning disability is classified as someone who experiences impairments related to perceiving, thinking, remembering, or learning. This may interfere with their language skills, their mathematics, their organizational skills, or even their social skills. So it's important that we learn how to support them. Of the disabilities, learning disabilities make up 42%, meaning that 5% of US public school population has a learning disability. There are multiple disabilities that fit under this umbrella, including dyslexia, nonverbal learning disabilities, and Down syndrome. A major health disparity for these individuals is that they are more prone to chronic diseases, especially obesity, diabetes, heart disease, and other related disorders. It is pertinent that we identify some of the root causes so that we can better support this population in our healthcare settings. Some possible reasons for this are their tendencies towards lower levels of education, lower socioeconomic statuses, and a difficulty understanding health advice. In our example with John, he had a really hard time meeting his daily needs in a healthy way, without his aide, without anyone that is going to walk him through these daily things. It may be that he doesn't have the language skills to process what he's taught about health, struggles executing it through his impaired organization skills, or even that he doesn't have the social support to meet his health goals. All of these are really important factors in someone living a healthy lifestyle. Within healthcare, it is important that healthcare workers are able to identify some of the signs of a person with a learning disability. This allows them to modify their healthcare in a way that meets that individual's health needs, that's personalized to them, and that's something that they'll be able to understand on their level. Another major concern with John's health is his vulnerability towards abuse from family and loved ones. 34% of people with a disability experience partner abuse, and 14% experience abuse from another adult family member. This abuse extends to aides as well. People with disabilities often have to use an aide to meet their daily needs and do things like cooking and cleaning and anything that you would do on a day-to-day basis. And so they're more prone to physical harm, emotional distress, and not receiving the support that they need throughout their day. A healthcare worker can help eliminate the elevated concern with abuse towards people with learning disabilities by recognizing the signs that a person is experiencing abuse and knowing what to do and who to contact in order to resolve this so that we know it doesn't happen in the future. Lastly, poverty is a major indicator of health among every population. People who are of a lower socioeconomic status typically experience shorter life expectancies, lower quality of life, and poorer health outcomes. Poverty is really important in understanding why someone might be experiencing health outcomes. This disproportionately affects people with learning disabilities because they are more likely to be impoverished than people without a disability. In 2014, about 30% of people with disabilities were impoverished compared to the 12% of people without disabilities, and a national rate of 15% at all statuses. When people experience poverty, they're more likely to have worse education surrounding health and poorer access to healthy lifestyles. This makes them more prone to chronic illnesses such as obesity and diabetes. Some of these reasons might be because of their sedentariness or their tendency towards unhealthy food. Healthcare provider can help to diminish the effects of poverty by finding ways of making their practice more accessible to the whole population, as well as through taking the time they have with patients to educate them on how to incorporate healthy options and active lifestyles into their own personal lives. To wrap up, people with learning disabilities are more prone to serious health outcomes. But through simple changes in healthcare provisions, the gaps can be closed further and they can be supported equitably throughout our healthcare system.